Infectious disease specialist Dr. Zain Chagla joins us this morning for his weekly update on all things COVID. Good morning, Dr. Chagla.
Hi, good morning.
So it seems every week we talk to you, we've got something new on this virus. I want to touch on this morning two different variant strains coming from England. One of them, two cases from South Africa.
So, these evolved, and again, it's still very preliminary, but these strains essentially have mutations to the spike protein, which is the protein we're targeting with the vaccine, to make them adhere a little bit better. It's not clear totally whether or not they transmit more, although there's more data emerging from the UK that suggests that certainly is the case and has replaced some of the cases there. So, there is some caution here. Obviously, this means that there are going to be more cases. Not clear whether or not that means more hospitalizations or deaths, and there hasn't been a signal towards that either. But, certainly a concern, particularly with our borders, to make sure that, variant strains, which may exist here in South Africa and, essentially could be anywhere in the world, are actually monitored appropriately. And again, our border controls are enforced such that these strains don't make themselves into Canada.
Are these like different strains of the flu that we have to protect ourselves? Is that something to liken it to?
Yeah, so there are viruses that are very, very well conserved that don't change over time particularly much, and that's like measles. There are viruses that change a lot over time, and that's like influenza, and coronaviruses are kind of in between. So they will change slightly, but not as much as influenza in that sense. And again, in the relative scheme of the structure of that spike protein between the new variant strain and what circulates here in Canada, 99% of it is exactly the same. It's a 1% difference. So it is a small difference. It may be enough to increase transmission. But yeah, it's still not as big as the jump we make every year with influenza.
Okay, and I want to kind of talk about influenza because we're hearing about the efficacy rates of the Pfizer vaccine and now the Moderna vaccine, both approved in Canada now. And we're hearing that, they have efficacy rates above 90%. And that's much, much higher than a regular flu shot that we get that's maybe 50 to 70% effective, right?
Yeah, it's interesting. I think, different viruses have different properties. And so, one of the characteristics of viruses that make it a good vaccine target is that they have a protein that is relatively conserved virus to virus to virus. In influenza, because it constantly mutates, it changes, the genetic structure actually predisposes to these changes, it's very hard to catch up, similar to even viruses like HIV, where we've never been able to develop a vaccine because we just can't find a good target for it. This mRNA platform combined with a conserved protein for COVID-19 at least is a good luck feature in that sense that we're actually able to generate an effective vaccine. I don't think anyone thought these vaccines would be 90% effective, but it's exceptionally hopeful that they are. And so I think it's one of these things we can reflect on at the end of the year, saying, at least this was in our favor for COVID-19 as a tool to get out of it.
Who would have thought we'd have been here? Now, with this hope of the vaccine, of course, there's people going, well, you know what, maybe we can get together for the holidays, for a family gathering. Our family is safe. Tell me, as an infectious disease specialist, how dangerous that is.
Yeah, just even in our own situation, right? In Hamilton, in Niagara, the hospitals are filled to capacity. There are discussions about, slowing down care. Thankfully, this time of year, there's a natural shutdown that helps with us managing beds. ICUs are filling up across the country. A mass vaccine campaign will not have effects on the population for 3 months and 6 months. And so, it's important that we ride out this next 3 and 6 months before relying on vaccine immunity as our way to open up. Also recognizing that, those close to us who have serious complications and die of this disease in the next 3 and 6 months, knowing that there is a solution on the horizon, that there is a way out, it's even more incentivizing to adhere at this point, just because we don't want to lose anyone where it's a preventable death, theoretically.
So yes, as much as you want to get together this Christmas, we keep hearing that, show your love by not getting together this year, right?
Absolutely. And again, it would be catastrophic for the province and not just for the region in that sense. So It's just so important. Right now we're at a critical point for our hospitals, and they cannot take any more. And so it's up to all of us to make sure that we can at least preserve medical care for the next 3 to 6 months.
Okay, so very good advice, as always. Thank you, Dr. Zain Chagla.
No problem. All the best.